Awesome. Okay, I'll go ahead and start. All right, my name is Zoe Kelly. I am here with Tomo Club and Dr. Al Lewis, who is the Superintendent of Schools in Weymouth Township School District and is the recent recipient of the Excellence in Small School District Leadership Award from the National Association of School Superintendents, which is awesome. Thank you so much for being here, Dr. Lewis.
Yeah, thank you so much for having me. I'm really excited to talk about social emotional learning and health of students and staff.
Great. Yes, so our topic today is prioritizing mental health and building resilient schools for students and staff. And on a personal level, I'm completing my master's in educational leadership. So I was thinking you could maybe give us a start with talking a bit about your leadership style, because I think that could be a good introduction to the topic.
Yeah, absolutely. One, congratulations. That's great. You're pursuing your graduate degree. That's amazing. Um, yeah, so I would describe my leadership style as primarily servant leadership. I believe firmly that I was called to serve those under my care, and I look at leadership as serving, my staff and my students to make sure that they have the things that they need to get their job done and to be healthy, whole people, right? So I would say primarily when I make decisions or when I plan systems or implement changes, I'm primarily looking for a people-centered lens to say, what will be the granular effect on total well-being for those underneath my leadership. Because I want to make sure that wherever I am, it's a people-centered workplace where people feel valued and empowered. And I like to design systems that allow a lot of like self-agency for
Mm.
staff members and students so that they feel like they have some level of ownership of the process and ownership of the product. So I've been published in the area of workplace or people-centered workplaces, and I can say that we've had great success here in Weymouth Township, making sure that people feel like they're cared for on an individual level and then also systematically.
That's great. And I think I thought that was a good start because when we think of mental health, sometimes it can be seen as a side note in schools. And so it sounds like your leadership style probably prioritizes that as something important. And so I was hoping you could give us a little introduction into how you approach mental health at your school district.
Yeah, absolutely. I would say, for students, obviously, we have a counseling program. We've expanded counseling services. Prior to my appointment, the district didn't have a guidance counselor on staff.
Mm.
So that was something that, we felt very strongly that needed to change, given, post-pandemic, people are dealing with more mental health issues than ever before.
Mhm.
Weymouth Township's a somewhat rural area, so there's a lack of like infrastructure, so to speak, especially for mental health services. And we want to make sure that we're serving as the community's anchor and that they're cared for at that level. Likewise, we have implemented social emotional learning products, things that help students learn those pro social skills and those coping mechanisms for dealing with trauma, dealing with mental health issues. We're a pre K to 8 district. So obviously, middle school brings with it its own certain, gravitas with mental health. So we have a middle school program, and then we also have an elementary program that's for students. And then on the other side of that, we have a mental health program for staff members as well.
Mm.
And we partner with Teacher Coach, which is like a teacher and staff facing mental health service where they have a digital platform and they can engage in like recorded videos and live sessions with therapists, licensed
Mm.
psychologists. And then they come on site as well, and we do small group sessions, individual counseling sessions, and all of it is, anonymous, so to speak. So I don't have access to what staff do or what they engage in. That way, they feel like it's not at all related to their employment. And then beyond that, we also offer different kinds of like well-being platforms, like financial well-being and financial coaching and strategies for staff members. Because we know that when our staff members aren't completely healthy, they can't really completely focus on their work. And we want them to be able to serve the kiddos. And then likewise, when our students aren't fully mentally addressed and engaged, they can't learn effectively. So we know, Maslow's hierarchy. We want to take care of everybody's basic needs and we want to take care of everybody's like deficient needs and make sure they're fully cared for. And then we know that they can really engage in innovative instruction.
That's amazing. And, you know, we at Tomo Club, we agree that social emotional learning is deeply tied to mental health, which is why I feel this is a relevant topic for us as well. And when I believe that all that you're doing right now is a bit above and beyond what many schools do, which is incredible, offering what you do. Can you tell us a little bit about how your district started implementing that? Was it already in place by the time you were here, or were you a part of that process?
Yeah, so a little bit of both. So that we already had a social emotional learning platform for students when I arrived. We found that it had been in place for quite some time, and it was time for probably a refresh
Mm,
between turnover and some staff members never having been trained on it, and then other staff members who had used it for so long, it kind of became like old news.
mm,
We did a little bit of research and we brought in a newer provider for our elementary students. And then for middle school, based on teacher and student feedback, they really liked what they had. So we just brought in the newest version of it to make sure that we were addressing things in the most modern way. The staff program teacher coach did not exist prior to my appointment. My dear friend Jared Schurz and Mark Gallo, I had already worked with them in my prior district, Gloucester Township. So I called them up and I said, we need help down here. Our teachers wear a lot of hats. There's the potential for a lot of burnout, and we had a lot of retention issues when I was appointed. And we want to put a stop to that. We want to keep the great people that we have. We want to care for them. So that was something that my curriculum director at the time, Helene Fulmer, and I brought in, and it has become a really popular program with teachers and staff and their families. So I'm really proud to say that we're putting our money where our mouth is, and not just saying that we care about our teachers and staff, but that we are willing to invest in them and invest time and financial resources to make sure that they're cared for.
yeah, that's amazing. I'm glad to hear that. And when we're thinking about creating those, you know, safe and supportive learning environments, we really do have to think holistically about how we approach it. So, talking about student care, talking about teacher care, even the greater community care, those are all really important for building a strong culture, school culture, and a school that trusts its leadership, right? And so I love how you talk about, you know, putting your money where your mouth is. I could see that really being a strong and effective program, providing that level of support for your teachers. And so, one thing I wanted to talk about is building that mental health literacy for our staff and our students. Have you had experience in, you know, kind of building that language up in order for us to even begin, or the school as a whole to begin talking about mental health, to be able to talk about social emotional learning with students and with staff?
Yeah, it's interesting, right? It's a process. You kind of just have to jump in, and you know that people are going to be slow to respond at first.
Mhm.
We have a regional health network, Atlantic Care, that does a lot of community engagement and student events here on site, like things for like families dealing with substance abuse and feelings of despair or depression. And at first people are kind of leery and they're not quite sure if they want to like own that stigma, so to speak. But I
Mhm.
find that the more we talk about it, and the more that we just put those programs in place, even if they're not well attended at first, they become very well attended, and people realize that that spotlight and that support network isn't going to go away, and they can engage with it, and they can be comfortable doing so. So yeah, I agree. It's tough at first, and you have to kind of battle that stigma, even when you're saying there is no stigma. And I try and personalize it and share. My family, like all families in America, are not immune to mental health issues or social emotional issues. And, I think putting that out there and talking with parents and being human with them first and right, being people centered
Mhm.
helps to destigmatize that over time. But it is a process and it does take time. And it takes, like you said, that the trust of the leadership to say that we're fully committed to this. It's not just a buzzword or like a flavor of the month.
Right. Yeah, yeah. I think it's really we have to be really comfortable in that initial uncomfortableness, right? Like it's always going to be that in the beginning. You know, we're working against you know, an old system that did not prioritize that. And so there is some trust building. I mean, even in my classes with students, I see that you know, our first few sessions together, a little more quiet, it's a little more reserved. Students don't know what to expect really, but as long as you're creating that safe space and you know allowing for creative thought, allowing for unique thought and not punishing that, I think is really when that trust starts to begin. And you talked a little bit about involving parents, in kind of creating that trust. Can you talk a little bit about, the parents' role in social emotional learning with their students at school or at home? Like, is there a way that you incorporate the parents into your social emotional learning curriculum at school?
Yeah, we do. So we do involve them. We have a social emotional learning curriculum for K to 5. It has an app that goes with it, and
Oh,
it allows the parent to both engage with the student, and also follow along with what they're learning so they can reinforce it at home. It also allows them to engage in learning. And we found that that's one of the biggest pieces, right, is educating the parent
yeah.
on social emotional learning, because I think there's a tendency, it's been politicized somewhat, and I think people think it means one thing or another, and there's some confusion. And we just want to give folks the factual truth. We just want to help people. We're not trying to teach anyone anything that's against their values, or we're not trying to interfere with their family's values or their genuinely held religious beliefs, but we're just trying to help people respond to what is scientifically based, right? Is that mental health trauma occurs. There's a piece there that the school does not address, societally we may not be addressing, and we just want to offer these resources to parents, and whether they engage with them or not is up to them, and that's okay. But they know it's there, and we do have families that engage in it, and they've dealt with trauma within their family, whether it's suicide or substance abuse or the loss of a parent, incarceration of a parent or loved one. And so we have those resources available to them, and we offer them in full transparency. There's nothing that the kids are given that the parents are not.
Right. Yeah, we definitely experience that on our end as well with sometimes a little bit of pushback around literally just the phrase of social emotional learning. But we do
Yep.
find that often when we discuss it in other ways, such as building life skills, building career readiness skills, parents and teachers are like, oh yes, of course we want that because of course.
Yep.
And so I think it's really helpful to recognize that stigma behind the word in order to work around it. Because at the end of the day, our parents, our teachers, they want the exact same thing for our kids, right? We just have to find that common language in the way that we understand it. And sometimes, I think recognizing that people come at it from different ways, but we're all trying to get to the same point is really important. That's
Yeah,
great.
exactly.
Um, So I wanted to talk a little bit about building that resilience in school for students, um, and the role of SEL life skills in school. Um, in what ways does your curriculum or your schools in general uh, work on that resilience part?
Yeah, so we have our four pillars, and resiliency and responsibility is one of them, where that's just infused in everything we do. It's part of our common language every day in Weymouth Township. We know that there are ups and downs in life, and we talk to the kids about like defining resiliency in a cognitively appropriate, definition for their age level, and we reinforce in everything they do that growth mindset of, yeah, things can be tough, but tomorrow can be better, and you may not be there yet, but you can get there one day, and you can be better one day, tomorrow than you were today. And we just build that into everything we do. And it's interesting because we mirror that. I coach my daughter's women's hockey team, and
Mm,
we put the same thing into our practice plans and into our approach to games, where we talk about the power of yet, where we
mm,
may not be as good as the other team yet, but we're going to get there. And we do the same thing here at school, where everybody wants to set a personal goal and work towards something. And our goal is for the kids to grow and grow as whole people. And we tell them that that's part of our resiliency as well, right?
yeah, yeah, that's great. And I think emphasizing the intentionality behind the teaching is really important. So, really embedding it into your practice. And I think that helps build that long-term understanding of it. You're always coming back to it. You're using that same language. You're going back to the same programs, and they're following through with it, from when they start school to when they end. And I think that really kind of puts it into their bones, right? They really
Yep.
feel it, they really believe it, which is the most important part. That's great. And so I'd like to start talking about some of the challenges in prioritizing mental health in schools. I know that a lot of barriers in, implementing mental health initiatives come from sometimes a lack of funding, time constraint, stigma. What were some of the challenges that you and your school district had in implementing some of these programs or
Yeah,
initiatives?
well, you hit the nail on the head, right? I would say primarily funding and time are almost always the obstacles to anything when it comes to school leadership. I know my dissertation focused on the barriers for science instruction for teachers, and it
Mm,
found one of those things to be, fully true, which is time. The teachers lack time, the administrators lack time, parents lack time, even kids, right? I mean, just children are just busier in general than they were, 20, 30 years ago because of the proliferation of youth sports and youth activities, and they're all good things, but they eat into our time and our focus. So we have found that implementing any intervention period we call the hawk huddle. So we've tried to be very creative and very targeted in how we manage their instructional time. But then beyond that, when it came to funding, we got a little we got the COVID money that was a boost, the federal funds, and we leveraged that in order to purchase something for social emotional learning for the kids and for the teachers. So um, in the future, that's going to be a hurdle. Weymouth Township has had its funding cut dramatically by the state
mm,
over the past 10 years. That's something I've had to come in and address, in my 3 years here. And it's something that I forecast being in our next like adoption cycle as being a major issue is the funding to get it. But like most things, we make the time and the money for the things that are important to us as people and as institutions. So again, it's a high priority for us, so we will make it work.
yeah, yeah, that's great. And yeah, I think there's a lot of uncertainty in our near future when it comes to education. So, we're just gonna have to be initiative takers, resilient. We're gonna have to think on our feet. But I think that, with COVID, we've all had a heavy dose of that already. So I think a lot of us have been prepared to come up with some creative solutions, and it would be great if it wasn't always so, having to find those ultra creative solutions. But, it's important to, understand where we're at now. So yeah, that's great. And so when it comes to your role as a superintendent, you know, what do you feel like is your most important uh, what do you think your most important role is in dealing with or in sorry. What do you think your biggest role is in creating these initiatives? So I know that you're kind of out of, you're not directly into the schools. Do you find it difficult to have that more intimate influence in the schools when creating these initiatives?
I would say primarily my primary role is to be a storyteller and both on both ends, right? I need to know intimately what is going on in schools and in classrooms,
Mhm.
and that just takes time, right? We talk about that time barrier again. But I look at it as one of my primary burdens of leadership, which is to intimately know what my coworkers experience on a daily basis.
Yeah.
Because if I don't understand that deeply, I'm very ineffective in implementing anything. I'm going to be most likely off target.
Hmm.
And I think we've all been there before as teachers, right? Where we feel like something was put into place and it doesn't really fix a problem, or it addresses a problem that I didn't really have.
Yeah.
So I would say that in one direction is important, and then the other direction, which is communicating that then outward to the board and to the community, and then to other stakeholders to make sure that they understand what the story of the district is and why we're bringing in these programs for staff and students. Because if not, they don't understand the mental health crises that's taking place across America right now in our schools for both the students and the teachers themselves. And it's in the news, this nationwide teacher shortage. New Jersey's certainly not immune to that. Weymouth Township certainly isn't immune to that either. But we know that we can make this a really nice place to work and learn, and that will draw people in and help to combat that shortage of qualified candidates. So I would say primarily storytelling is my primary role. And then beyond that, it's to be a problem solver, right? I am doing things so that a stakeholder group can make a recommendation, implement that recommendation, and then it's my job to analyze and then make refinements to that program. And I look at that as being, again, another way to be in classrooms and learn how things are going, which is to then collect that data or analyze that data of, are the programs we brought in really helping kids?
Mhm.
Because if they're not, it's not worth having. And are they really serving our staff members? Because if it's not, it's worthless to us as an organization. We are a people business, and we're going to care for the people under our care. So that is squarely on my shoulders.
Yeah, absolutely. And do you have any advice when it comes to like building those partnerships, building those relationships with, the greater school community, especially when we're thinking about mental health professionals, community organizers that are a part of these initiatives?
Yeah, again, it takes time. You have to put yourself in the places where those people congregate and where those events are. I mean, I know no one really likes like going out to conferences and being out of office or anything like that, but you have to go and you have
Mhm.
to forge those relationships. Likewise, with local and civic organizations in our area, being involved with them and connecting with them has been very valuable to the school. We have a very close relationship with our town hall and our mayor, with our New Jersey State Police. We have a very good relationship, like I said, with Atlantic Care, which is a health network in our area. And our county office does a great job. The Atlantic County Division of Department of Ed here, a phenomenal job of connecting superintendents to the network of resources that help our schools every day. I can't say enough about our executive county superintendent and her staff. They make sure that we have a bulleted list of every single agency that aids children and adults in our county, and that is invaluable to us.
That's incredible. Yeah, having a strong team behind you is so important. That's great that you have that. And so, as we start wrapping up, I wanted to ask if you had any actionable steps for other school leaders who are interested in implementing, either SEL programs or mental health initiatives into their school, and they're not quite sure where to begin. What would you say to them?
Yeah. Don't reinvent the wheel. First of all, go to your colleagues. Certainly, if anyone wants to reach out to me, you can find me on LinkedIn or on the school's website. I'd be happy to help you brainstorm things or share what we've done. But talk to the people in your area. I have a great support network of people. I literally just called my friend Dave Capuccio, who's a nearby superintendent today, and asked his advice on something. So, pull in your support network, get that feedback of what people are doing, what works, what doesn't work, and then lean into those relationships a little bit to help you then form a vision collaboratively with the people under your care, right? Set that common vision, set that common language, like you had mentioned earlier, and then, make sure that ultimately what you're doing is going to help people. And the only way you can really know that is if the people who it's going to help are part of the process. So, be sure to include that committee of stakeholders.
Absolutely. Yeah, great advice. Thank you so much, Dr. Lewis. So that will end our podcast for today. Thank you so much for joining us and talking about mental health. It's more important than ever. And you can find Dr. Lewis on LinkedIn as well as Tomo Club. You can find me, Zoe Kelly, on LinkedIn. Thank you so much for listening.
Thank you so much for having me.